Depression, a serious condition that should be taken seriously. A 35-year-old teacher came to see me and said that he had been feeling tired, had lost his appetite, and had lost weight for the past 8 months. He had difficulty falling asleep and was bored. His attention and concentration had decreased, which is why he did not have enough concentration to teach students in class. Students and their parents were not happy with his classroom. The school may terminate his contract. He was feeling sad and upset and cried for a few minutes every day. He went to bed late at night and could not wake up from fatigue in the morning. He was inclined to be alone. He felt worthless and thought he was not a useful person. The patient and his companion said that his symptoms had worsened in the past month and that he no longer went outside and had no desire to go to class. He kept saying to himself that he wished he was dead. He had prepared a type of pill to commit suicide, but his family had prevented him from doing so. The patient had a history of hypothyroidism, which was being treated with levothyroxine. He had never consulted a psychiatrist. He had a history of smoking cigarettes, but he only smoked occasionally. According to his companion, the patient's mother and brother had a history of depression and were being treated with Sertraline. They had responded well to this drug. Based on these symptoms, including loss of appetite, insomnia, feelings of worthlessness, decreased energy, lack of concentration, decreased activity, feelings of depression, and thoughts and plans of suicide, he was diagnosed with major depressive disorder. Because his mother and brother had been diagnosed with depression and had responded well to Sertraline, he was started on Sertraline. In addition, because of his difficulty falling asleep, he was started on Lorazepam. After 2 weeks of starting treatment and increasing the dose of Sertraline, the patient responded well to the drug like his mother and brother, and the symptoms of depression gradually faded in him. The patient was also given thyroid and blood tests. I reviewed the tests and found no signs of hypothyroidism. I explained to the patient and his companion that they should come to see me weekly until the patient's condition stabilized. I also advised them to keep any sharp objects, cleaning products, poisons, rice pills, and medicines out of his reach. In this particular case, the patient was completely cured and returned to his normal life after about 6 months of taking the drugs on time, following the recommendations, and also with his strong will and determination. He now spends more time on his classroom, and students and their parents are happy with him. He may be selected as the Teacher of the Year. If this video has been helpful for you, please subscribe to our channel and like this video. By doing this, you are making a great contribution to raising awareness among people. Here, I want to tell you some tips about depression. So stay with me. Depressed mood and disinterest or lack of pleasure are the main symptoms of depression. Fatigue, low energy, inattention, insomnia, early wakefulness, weight or appetite gain or loss, increased or decreased sleep, increased or decreased activity, thoughts of worthlessness or guilt, thoughts or plans of suicide are other symptoms of depression. Among the observable signs, slowness of movement is the most commonly reported symptom. Depression is a mood disorder whose central feature is mood disturbance. Patients feel bad and use words like depressed, sad, low mood to describe it. Of course, many patients are reluctant to use the word depressed, as it may be difficult for them to cope with this diagnosis. Depression in children, teenagers, and the elderly is different from that in adults. We will definitely discuss it in future videos. As you saw in the video, one of the symptoms of depression is insomnia. We have made a video on this topic. If you like, you can watch it as well.